Hi, this is Dr. Kim. There was a question about insomnia, and insomnia is one of the more difficult conditions because if you don't get good sleep, pretty much that's the best way to ensure the next day you're not feeling your best, you're not functioning your best. So the the function first of all, so the insomnia treatment begins the day before actually. So the day before, what I recommend is sleeping is complex, and LDN can be very helpful if you can tolerate it at night. If you do not have night terrors or nightmares, because LDN actually will decrease inflammation in your nervous system, calms down your nervous system, and also will uh, make it easier to fall asleep, enhance your REM sleep, and disrupt sleep interruption. So, in my practice, I don't like to prescribe any medication with the exceptions of LDN. So, the LDN probably will be the first one I'll try. If the person says it doesn't work, then I'll probably change the dose, maybe go up on it, um, and until that we're at a place that it's doing the job. Now, one of the more difficult things about sleeping is that your body will fight back if there are issues. So there are two types of fatigue I always ask. Do you fall asleep whenever you stop what you're doing? Do you just fall asleep? Versus even when you sleep, do you not recover? So there are two types. One is that solution would be usually more sleep. The second one, where you're not getting rest the restorative effect of the sleep, is a bit more difficult, and that is what most of my patients complain of. So when patients have that, I try the LDN, up the dose, and if it's still resistant, then we have to have a talk with the patient. Is that do you do should we explore root causes? And root causes in functional medicine means that we are going to be using the things like functional medicine testing, and we can test their hormones. We can look at their cortisol. We can look at their sugar instability, micronutrient deficiencies, chronic inflammation, infections, toxin exposure, such as mycotoxin or heavy metals, or medication side effects, or neurotransmitter imbalances. So that's probably beyond the scope of this practice, scope of this video. And so what we will talk about instead is what are the common lifestyle things that I talk about. So first thing, it would be magnesium threonate, or glycinate, or even citrates can work, and it's just relaxation and reducing tension, especially if there is a history of muscle contractions. The second thing I do use, even for myself, would be besides LDN, I may try theanine, um, a combination of theanine and GABA, which is an amino acids. And next thing that I may try would be using 5-HTP in the morning, and then low dose melatonin, like less than 1 milligram at night. And the other things may be using adaptogens, especially rhodiola, which has calming effect. And the other thing that I do recommend sometimes would be trial of CBD, although it doesn't work for everyone. So remember that in functional medicine, that we look at a lot of different things, but if you're not able to do the testing, there are lifestyle things we use in integrative medicine that we can use those, and then sometimes that will also give us more information on how your insomnia response can give us a clue on what's doing. So what not to do: don't take all of the supplements at one time. That's probably what not to do. Take one and then give it maybe a week, and then go on to and then what I call paired response, like theanine, GABA is a paired response, 5-HTP and melatonin is a combined approach, using maybe ashwagandha and rhodiola is a combined response. And some of it is helpful to have someone work with you, someone who has integrated medicine, functional medicine, naturopathic medicine, work with you can be quite helpful, because sometimes the providers asking questions can give you insights, and but I would say that sleep is probably one of the most important pillars in wellness is sleep. So do your best and figure things out, and hopefully this video will help you to get some ideas. And if you learned something or like the video, please give me a like. Thank you.